gentlemen. Colleagues, friends, it's such a pleasure to see all of you here, particularly in this post-lunch session, which can be a challenge. It's a particular pleasure to welcome you to what I think is a very important discussion, addressing pandemic threats through the lens of climate change. And as the chair of the CEPI board, my name is Jane Halton, I'm delighted to be moderating today's session. I think we all know that the impact of climate change on human health is completely unarguable. It's undeniable. And I think we know, as we watch vision of floods, of hurricanes, and all of the devastation we see on our televisions or our streaming services, that these things are problematic for people, for health workers, and for health systems. But of course, just as threatening as those particular events can be and are, the spread of potentially infectious diseases, deadly infectious outbreaks, can be themselves a problem. And of course, we all know the world is getting hotter, it's getting wetter, it's getting closer. And my notes say less predictable. The reality is everything is being disrupted. And of course, what do we know about mosquitoes? They like it hotter, warmer, wetter. And of course, there are other things where the habitats are changing, they're moving, and are very conducive to the spread of disease. So, with things like mosquitoes, with thinking about breeding, feeding, migration, and geography, we all know that this brings with it risk. And an opportunity for zoonosis, for zoonotic disease, to jump to a new type of host, and all of the threat that that brings with it is something that we have to be aware of. There's an interesting study that was published in 2022 in Nature Climate Change, which actually found that more than half of known human pathogenic diseases are aggravated by climate change. Now, of course, CEPI's mission is to actually enhance global epidemic and pandemic preparedness through the development of vaccines against a number of pathogens that pose this kind of threat. And of course, as we've done that work, we've actually understood that the importance of health systems resilience and dealing with threats such as climate changes are really important. In that context, we are spending nearly $430 million in vaccine research and development against Lassa fever, Rift Valley fever, Nipah and chikungunya. And of course, all of these have an epidemic and potential pandemic threat. I'm also delighted to announce today that we are actually going to spend $3.7 million through a new funding agreement with the Kenyan Medical Research Institute, our good friends at Wellcome, and the University of Oxford on a first ever phase 2 trial for a Rift Valley fever vaccine in an endemic country. Our investments in versatile vaccine platforms such as mRNA are all about the ability to tackle the new, the rapid, and the unexpected. And of course, speed is fundamental. We've just seen the importance of speed in relation to the Marburg virus. For those of you who don't know, a filovirus from the same family as Ebola, and working with Sabin, the Rwandan government, who declared an outbreak of Marburg on the 27th of September, and of course then notified WHO, CEPI and many other partners. That meant that negotiations could happen quickly, partnership here was key. The first shipment of that vaccine, the candidate vaccine, from Sabin's storage was arranged from Italy, and by the 6th of October, the first 700 doses of that vaccine was deployed in a clinical trial targeting Rwandan health workers. That's just 10 days after the outbreak. There's much more to do, but that of itself is such a significant achievement. So, speed, efficiency, and then at the same time thinking about the gaps in our system are absolutely crucial. And whilst it is the case that so often the countries who are least responsible for climate change are often at greatest risk from its effects, what we need to do to build global resilience is actually make sure that no nation, no population is left behind. It's classic case of together we are stronger. And of course, we also know that we need the world to work together in a very active way. And so we've been happy to join the Alliance on Action on Climate and Health. And we know that there'll be many more partners who will need to join, because as we all understand, we're talking here about animal, environmental and human health interacting. We need greater cooperation, deeper integration between human health, animal health and these environmental systems to prevent, detect and respond to emerging threats. And we see that as a very fundamental challenge, which is right smack in the core of the CEPI mission. We're in the early stages of this journey, and one of the reasons I think this discussion today is so important is we need to think about and then implement a holistic approach in partnership to deliver the best outcomes. And there is no further group who are better to talk about this challenge. We have a really distinguished panel who are going to join us for this discussion today. Maria Nera, who will be known to many of you as the Director of the Department of Environment, Climate Change and Health from the WHO. Professor Victor Zhao, President of the US National Academy of Medicine, who I've decided knows every single person at this entire event. Dr. Katinji Gitai, who is the CEO, Global CEO of AMREF Health Africa and a CEPI board member. Dr. Jenny Miller, Executive Director of Global Climate and Health Alliance, and of course she also co-chairs the WHO Civil Society Working Group on Climate and Health. And Dr. Ramanan Laxminarayan, who is the founder and president of the One Health Trust. Can I ask you to welcome our panel? So thank you, panel, for joining us here today. And we will have, for our audience's benefit, I'm hoping, if everyone is disciplined, a good opportunity for the audience to ask questions of the panel members. But before we do that, let's get some views from our panel members, if we might. And I'm going to start with you, if I could, Maria. So we talk about this connection between climate change, epidemic and pandemic risk. But where are you seeing this? How does it actually show itself? And are you seeing greater numbers of outbreaks?
Thank you.
She just touched it. The AV guy is going to leap to the front any second. What did she say? No touching.
You have to talk like this.
We've got very firm instructions.
Okay, you are giving instructions to a non-disciplined person, so you know what the consequences will be. Anyway, I will behave from now on and not move. I'm Spanish, that will be a little bit difficult. Anyway, thanks for starting with this nice tone and making sure that our room is going to smile. Maybe when I will start to put some figures on the table, their smile may be a little bit less. But let's start with something, Jane. No discussion around the fact that climate change is affecting our health. You put it very well on your introductory remarks. This is a very, very clear diagnosis. No one is questioning that climate change is affecting our health. Just a very quick overview. It's affecting globally and worldwide the health of the people because we are having an increase in the number of extreme weather events on intensity. We are having heat waves, and many people around has been suffering that. We are having an increase on the disease burden, particularly vector-borne and waterborne. We are having a disruption of the food systems, and we are having a deterioration on the quality of the air we breathe. Mental health and displacement, what else? I mean, if this is not a diagnosis that puts you a sense of the magnitude of the problem and the vitesse, I mean, the speed at which we need to respond, what else? This is just Clooney, no, saying that normally on Nespresso, what else? No, this is for climate change, what else? Yeah. So next is what do we do? And particularly now the connection with the pandemic treaty. Yes, we are very much concerned about the pandemic emergence. Yes, we are very much concerned about how to respond. My answer to that is, we know that we are going to have more vector-borne diseases. We have it already. The mosquitoes are having the perfect conditions for reproduction in places where they didn't have it before. We have an increase on the prevalence of diseases like dengue or malaria in some places around the world. We have the fact that if you have problems related to access to water or too much water, then the next one are the diarrheal, epidemic diarrheal diseases and cholera. So clearly the diagnosis will leave very little space for the responses you need to put in place. And these are the responses. If you want to have a very good pandemic treaty, you need to make sure that you incorporate the One Health approach. Why the One Health? Because the human health and animal health approach, I think, is very well understood by everyone. When you look at new emergence of new virus, everybody understands the importance of animal health as well. But the importance of environmental health is the one that maybe is not at the same level of understanding by the population. Let me tell you, if you don't want to have, or you want to reduce the probability of having a new virus, a new bacteria, a new threat emerging, put a green wall. Put a green wall. Protect your ecosystems. Make sure that your ecosystems are not destroyed, because by destroying the ecosystems, by having this destruction of the biodiversity, the way we are now polluting our environment, this is the first condition for any emerging infections to have better opportunities to emerge. Second recommendation, normally when you are looking at how to deal with a pandemic, you will look at the issue of vaccines that you mentioned as well. Let me tell you another recommendation here, a little bit provocative. When you talk about vaccines, add a new one that nobody thought about yet. The vaccine of tackling the causes of climate change. Because when you tackle the causes of climate change, there is no better vaccine that will protect us, because it will be tackling all of those environmental risk factors that now are creating the perfect conditions for this emergence of new virus or bacteria can threaten all of us. So this is my call on this pandemic treaty, having a holistic common sense, because after all, this is a common sense approach at looking at public health. And of course, the investment part is very important. But maybe you want me to stop there and you want to...
No? Well, no, we can...
Because if you don't stop me, I can...
Don't worry, I'll stop you when I need to.
Okay.
But let me pose you another question. There's a number of people in this room, I can see a number of you, who I know are passionate about One Health. And a lot of the people with flat foreheads who've been beating it against a wall because they've been trying to get people to pay attention to the importance of One Health, that's how you can spot them, right? How do we get political leaders and the global health community for that matter to actually think about climate change and infectious diseases? Now, we know there are more elections in this year in democracies around the world, so politicians, at least in theory, should be paying attention. But are they? And how do we get some traction on these issues? And what can WHO and indeed CEPI do about that?
Yes, definitely the answer to your question, whether the politicians are putting attention, is warm no. Because yes, they are paying attention, but not at the level of ambition and the speed that the magnitude of the issue will require. So yes, when we started to go around on the climate change negotiating bodies, the COPs, and we were saying we are hello, we are the health people, we are from the World Health Organization, and they were looking at us and saying, who? And then we say, yes,
exactly.
who? Yeah. But, now the situation is different. Now everybody is convinced that we should use the health argument to mobilize a little bit. But if you use the climate change lens, the public health lens, we will not be as slow as the negotiation at the COP are. You will not imagine a public health emergency taking 29 years to negotiate. They will kill us, and there will be right to do it. So I think, again, this speed on the responses we need to give to the climate change, the environmental health crisis is fundamental. The good thing is that if you respond to that and you prepare your health systems to be more climate resilient, to be adapted to what is happening because of the climate change, what you are doing is working on the pandemic preparedness. Yes. Definitely, on any outbreak preparedness. The more you invest on your health systems, this is a non-regret investment. This is the common sense investment in public health. So aligning forces and making sure that we are synergistic on that, strategically coherent, is the best way. Investing on preparing our health system to cope with the consequences of climate change means more vector control. And that will be good for malaria, will be good for dengue, will be good for any vector-borne disease. Preparing your health system to be more resilient, more adapted to climate change, means having a better trained health professionals, means having a better epidemic surveillance system, addressing those diseases that we expect to see, means more financing on water and sanitation. So means that we are investing on a common sense, no regret investment that will be useful to cope with the consequences of climate change, to prepare our health systems to be more resilient and better prepared, and at the same time to be the first barrier, a reinforced one for any outbreak, emergence, or pandemic, or whatever for which we need to be better prepared.
Yeah, better health systems, better preparedness equals better health. Indeed.
I think so.
I think so too. So let's think now, if we could, about the whole role of health and medical research. And we know that the more information, and dare I say facts in sometimes a fact-free world, that is, at least for professionals who work in this space, who care about these things, that gives you a basis for action in which you can have confidence. And Victor, you're the obvious person to talk about this. So what do you think the role of research and development is when we start to talk about this intersection between climate change, pandemics, and indeed health?
Right. First of all, it's really hard to follow Maria. She's passionate, she's articulate, and she knows what she's talking about, being Spanish. So, okay, so thank you, because I think to make a link between pandemic and climate change is really important, right? Because as Maria said, the thing about climate itself, of course, it causes so many different issues beyond infectious outbreak, because it's got air pollution, extreme weather events, and so, but I think the focus between these is important, because if you think about what are existential threats, well, we just lived through one called COVID-19. Now you just follow what's happening in my country, where Hurricane Helene, Hurricane Milton, I mean, it's really obvious, these extreme weather events. Now, so the question is, the politicians should get it, right? They got hit on both sides. We talk billions of dollars of loss in climate change on one hand, and then trillions of dollars with pandemic. Now, it's easy to put them together because if you follow what happens in many of these events, you see actually a rise in infection, whether it's vector-borne, waterborne, you name it. But your asked question about research is so important, because the question is, what do we know, what don't we know? I'll say there's a lot we don't know, right? To begin with, climate change, as you said, that study, from University of Hawaii and Minnesota says 58% of the worldwide infectious disease are aggravated by climate change, and did an extensive research, literature search, and empirical evidence. So it's very clear. So number one would be, why? Right? So there's a lot to be studied about why climate change drives up these infectious outbreaks. Right? And I can come back to that. The second, of course, is what are the pathways that climate change affects water systems, agriculture, you name it, and what are those pathways that make things worse? Third, of course, is what we do about this. There's research and mitigation and adaptation, and you're going to hear from my colleagues. Actually, there's so little known. While people in low-income countries are doing whatever they can, there's really not a lot of research known what works, what doesn't work, right? And mitigation, of course, is a very big area of how to reduce carbon emission. Climate change increases antimicrobial resistance, your favorite topic, right? And that's another one that needs to be studied. Why? And of course, ultimately, there's a whole research area about technology, capacity, policy, you name it. But let's just take a few of these areas and try and unpack them. So if you think about why climate change increases vector-borne and waterborne diseases, I think it is known that if you look at changes in climate, particularly if you get high temperatures, the reproductive cycles are faster, incubation periods are shorter, and the exposure time is longer. So therefore, you're going to see a lot of vectors being able to reproduce, and then of course they migrate further to the north, right? So you can see what happened in dengue in Brazil and many other areas. So that's one of the certain mechanisms, right?
Or further south.
Oh,
In the
further
southern
south,
hemisphere.
Yes. North, south, you're right.
I have a thing
warmer
about
climate.
hemispherism.
She's right. To a warmer climate, north or south.
Thank you.
Thank you. So I think these are really fundamental issues that need to be studied. And of course, how do you mitigate this? By the way, when you come up with a vaccine, I'm going to take this right away, right? From climate change. AMR, I mean, how does it increase AMR, right? Well, it turns out that obviously you're dealing with selection of organisms that are resistant. Why? Because climate change can change, let's say, the concentration of metals and biocide in the soil, which leads to more resistance. There's also a lot of what they call gene transfer between organisms. So that's another mechanism. Another one could well be that when you have a lot more infection, people prescribe a lot more antibiotics, and therefore you get this AMR. I think what's relevant to SEPI to me is really the issue of surveillance, an issue of resilience, as you mentioned. Think about supply chain, right? Vaccines are dependent on, we saw that in COVID-19, right, in a big way. Supply chain was disrupted, or for that matter, Ukraine, supply chain was disrupted. So that we really have to study resilient supply chain as it looks at pandemic and climate. And then I think about vaccine. Maria and I was talking about at lunchtime, right? Your vaccines, mRNA, cold chain vaccines, can withstand weather changes. So there's got to be a lot of research about resilience, robust vaccines that can thermostable medical countermeasures. Right? I mean, so these are some of the areas that one can think about in terms of looking at this area of this research, I believe. Now, finally, of course, you're going to hear from my colleagues about the need to have really data. I think there's certainly not a lot of information, particularly from Global South, low-income countries, adaptation, and what are the different knowing population at risk. So there's a lot of research. I think the research is wide open. The more information we have, the more likely we can come with the right interventions.
Do you want to tell us a little bit about what the National Academy of Medicine has done in relation to the initiative to accelerate the the National Climate and Health Movement. So
Yeah.
there's particular things that you're doing. I think it'd be good for people to hear about.
Well, you know, so we thought this is such an important issue that the only way to address this is to do a huge public-private partnership. So it's not only for the academics and scientists or the clinician, but it involves private sectors, it involves government to solve this problem. So we launched what's known as a grand challenge. And one important area of grand challenge, Jane, actually is the research, because we want to look at what are the gaps in research and how do you set a research agenda for anybody who wants to study climate and health. But the other areas, as you said, relates to the intersection of different sectors, energy, agriculture, transportation, on climate and on health. Most of these sectors don't look at the impact on health. They look at what happens to carbon emission and mitigation. So we're really interested in bringing together a sector, multi-sector approach. The one that Jane reports to is that we've started a whole initiative, look at how to decarbonize the health sector. Many of you may or may not know that globally, the health sector emits 5% of total carbon emission. In our country, it's 8.5%. So it takes everybody to say, let's change the practice of medicine, let's look at supply chains, let's look at manufacturing, do this. So to do that, we launched a movement in our country, and now we have, tried to sign up as many health organizations as possible to join this movement. And in this regard, actually, we now have close to 1,000 hospitals and others joining the movement about we're going to change the practice, we're going to look at low carbon emission practice, we're going to look at supply chain and so on and so forth. Final issue, of course, is equity. You're going to hear a lot more about the issue of equity. Marginalized population, indigenous population, a lot more, in fact, vulnerable to climate change. So we're doing a lot of work in that area as well.
We need more, but it's good to hear.
Thank you.
And speaking about equity, my good friend Gatinji, I mean, the Global South, disproportionately affected, we understand that, and that's despite creating much less of these greenhouse gases than the Global North. Can you talk a little bit about how the Global South can use its voice in this context as part of this discussion on this relationship between climate and health? I mean, what are the opportunities, do you think, to amplify those messages, which comes from, apart from anything else, the need for a more equitable world?
Thanks, Jen. And I don't think it's by mistake that this meeting is happening in a room called Africa. And next door is Europe, so you must clap louder than Europe. Huh? Yeah, please. Yeah, please. Yeah. And let me demonstrate something, if you allow me. I don't know whether there is anybody from this side who is from DR Congo or any sub-Saharan African country. If you are, just stand up. Any sub-Saharan, not South Africa and not Egypt. Okay, that's enough. Not South Africa, not Egypt. You can keep standing, it's fine. And on this side, I want people from Europe to stand. If you're from Europe, stand.
Enough said.
Good. Now, let me just make this question you've asked about. No, please keep standing. Yeah, I mean, it's just 2 seconds and you already want to sit. No. So the folks on this side, not them generally because they are traveling and everything, but the average person they're representing on this side will take 150 years to emit the same carbon in metric terms as the people standing on this side. 150 years, DR Congo emits about 0.03 metric tons per capita per year. Europe is 8 metric tons. So you can do the math. Divide 0.8 by 0.03. If you go to the US at 14 metric tons, you're talking 466 years of emission. Please sit down. That's the level of inequality in this conversation. The reason I'm demonstrating that is to say that despite the fact that the folks who are standing on this side are emitting so little, the emissions are globally distributed, and that means that the warming is globally distributed into the environment and the oceans, and therefore a flooding incident will be equal in impact. The disease changes will be equal in impact. These folks will not have a discount on the impact because they emitted so little than these folks on this side. Now, it's saying that, if I was just to put this in perspective, in my country, around April, early April, about 19th of April, one night, a village woke up to a flooding incident. In that night, 51 people were wiped out of the face of the earth because they were living on a village and the flooding filled up, the rain, extreme rain, filled up a dam upstream and it swept 51 people down. Now, that incident may be the same in terms of when you're talking about extreme weather events as Hurricane Milton. The difference is that if you look at the people, and every life is of equal value. So I'm talking about infrastructural changes here. Every life is of equal value. If you talk about the woman who was in this particular area called Mai Mahiu in Kenya, and the woman who might be around the hurricane that was going on in Florida, the woman in Florida has a government investment in fiscal terms of $5,000 of public money for health per capita per year. 5,000. Meaning that even with that flooding, there could be an adequate health system response. We still lose lives, unfortunately. I think 17 have been lost in Florida or around the hurricane. But you still lose lives. But you have $5,000 of government investment, not private money, invested in health per year. The woman in Mai Mahiu has at best $40 of government investment in the health system. It means, therefore, that this whole global phenomenon of climate change cannot be had without us talking about vulnerability risks. That the most vulnerable are the ones with the least contribution, as we have actually demonstrated. So the question is, Jane, how has it taken so long to bring people's lives on the table of climate conversations? And I think that is the answer to the question you're asking, that the global south, because I just use Africa as a representative, because Africa is where we have only one carbon metric ton per emission. You know, other countries will be 2.5 and above, other regions. So let's use Africa as representing the global south. The real terms or the real impact of this whole carbon emission conversation is actually in human terms. It's actually in human life. It is in health, as Maria was saying. And it's taken us so many COPs. It is only in COP 28. 28 COPs later is when we actually brought human life and health conversations on the table. Shame on us. And now we are saying that the global south must stand up and bring the stories of people, the voices of people, to the policy-making table and the policy-making conversation on climate, because it is ultimately about human life. And that balance of One Health, at the end of it, we are here, it is going to be counted in lives saved or lives lost. No, how does the Global South do this? The first thing is exactly that. Bring real stories, human life, to the table for climate conversations. Let us shift from inanimate conversations. They are important, but at the end, we are doing these inanimate conversations so that we can then save human life. And by saving human life, we hope we'll be able to save planetary life generally. We are actually successful to a certain extent. Working with WHO, working with civil society, and working with governments, we have actually brought this conversation. In COP28, we managed to bring more than 100 governments to bring their ministers of health for the first time to a COP to sign a health declaration. So that movement has to be in the hands of the Global South, not that the Global North ministries will not matter. They are extremely important because this is a convention of both adaptation and mitigation. But the adaptation side, the people feeling the pinch, is the Global South, and we have to bring that voice. So we managed to do that. We managed to get a health declaration. We managed to actually then ask what is it that the global goals are going to do. And now there is a whole conversation on the global goal on adaptation. I've just come with Jenny from a meeting in Bellagio discussing indicators, measurement, because that's the other thing that the Global South must do. Demonstrate and work with the world to demonstrate through indicators that actually this is happening. I was talking earlier to Professor here, we're saying on adaptation, because it's been ignored for so long, we don't have available data other than projections and modeling on the real impact on the health systems, on disease patterns, waterborne disease, what's going on. But we know. We know even before the publishing. If you talk to the Minister of Health from Malawi, she'll tell you they had the longest cholera outbreak after the flooding that happened. They lost so many people. If you talk to any government in Mozambique, Madagascar, they'll tell you what's going on in Liberia and elsewhere, Bangladesh. So we have this information. So the Global South must bring the human face of the climate crisis to the policy-making table. That's what I would say.
Okay. And Gitinji, every one of these people in this room for a second think that they're a minister of health from a country. And the person they sit next to is the leader of that country. If you could convince the health minister and the head of whichever the country is, whether they're high income, but particularly if they're low income, low to middle income country, what would be the 2 or 3 things you would want them to think about in relation to making sure that we deal with the issues of disadvantage and the magnified impact of climate change on particularly disadvantaged communities? What would be your message to them briefly? What's your headline to them? What should they be thinking about?
My headline here is simple, that stop polluting, and if you pollute, pay. It's as simple as that. We must have conversations about this, about who bears the cost. And this is where we're having conversations on loss and damage and all these things. Stop polluting, shift away from fossil fuels, but if you have to, pay, and pay dearly. So we must have conversations on carbon tax. We must have conversations on investing in a global health system.
Yep.
A global health system that protects everybody. I have had here Jane about, of course, and I know there are many Germans here, about the German government reduction in development aid by €1 billion, 2 billion. It is an own goal. It is an own goal. Because ultimately, a weak health system in DR Congo is a vulnerability for Germany, is a vulnerability for the US. When we had the Marburg outbreak in Tanzania, it is a community health worker who had been trained to watch out for Ebola transmission from Uganda when there was an outbreak in Uganda, who through that mechanism of capacity to develop event-based surveillance, just looking at the village, looking at what's going on. It is that community health worker, 21-year-old young woman, who actually raised the alarm on the Marburg virus, and that is why it was actually handled so quickly, because, and therefore protected that community health worker, 21-year-old female, protected you and I. So it's a responsibility for all of us to invest in a globally robust, resilient health system that is climate resilient, because a climate resilient health system is a pandemic ready health system.
Excellent.
Yes.
I'm not going to get Gitinji. Thank you. I'm not going to get Gitinji a job in newspapers where he writes pithy headlines, but he can write my feature article anytime he wants. Let me go now to Jenny. And civil society is absolutely crucial as part of these discussions. We all, I think, know that. And I guess the fundamental question is, what can civil society do? And how can it focus on these combined threats? What do you think are the opportunities and threats that civil society should be responding to?
Yeah, and I absolutely agree with Gatinji about the vital importance of getting exactly those kinds of stories into the halls where those decisions are being made about climate change. And I think that's where civil society can play a really vital role. The Global Climate and Health Alliance, which I run, was created initially, and with the support of the WHO at the outset as well, because there were a small handful of health organizations that had begun going to the UN climate negotiations and other places where climate decisions were getting made, and they realized health was not in the discussion at all. It was not on the table. And research was clear that already we were starting to see health impacts of climate change, and that they were going to get worse. They were going to affect infectious diseases. They were going to affect food and water access. They were going to bring extreme heat, extreme weather events. And also already it was clear that those impacts were going to compound the vulnerabilities of already stressed communities and countries around the world, and that they would be feeling the worst impacts. But this wasn't part of the conversation. So those organizations realized that in order to get health on the table, we needed to build a joint, collective, powerful voice from the health community, and really insist that climate change was a health issue. So some of what happened along the way is a number of mobilizations of the health community. A couple of those mobilizations got sign-on from organizations around the world representing 46 million health workers and health professionals, insisting that climate change is a health issue and health has to be considered in those discussions of climate change. Some of the result of that is that in COP26, WHO was able to bring to the table the COP26 health program. Countries committed to making their health systems more resilient, decarbonizing their health systems in some cases. At COP28 last year, as Gatinji mentioned, we had a climate and health declaration signed on by 151 countries. Just this year, at the World Health Assembly, in that context, there was a World Health Assembly resolution, which of course was adopted by consensus by 197 countries. I think for me, one of the most interesting components of both the Health Declaration and the WHA resolution is that because countries had to sign on to something that was a climate and health declaration or resolution, there had to be conversations within government between health ministries, environment ministries, finance ministries, et cetera. So really generating that conversation around the fact that climate change and health are interlinked and have to be addressed together. Concretely, what does this mean for addressing climate change, addressing pandemics, increasing resilience? We're not there yet, as everybody on the panel has said, of course, but there is increasing momentum for health system resilience against climate change and preparedness, the capacity, the resilience of the facilities, the resources to be ready for pandemics and other health impacts. To speak to something that Gatinji mentioned that I think is vitally important, the other thing we're starting to see momentum on is financing. And again, on this one, we're very much not there yet. But the Green Climate Fund now has a health person on staff. That is a vast step forward. We're also seeing conversations at the Global Fund, at the World Bank. The Rockefeller Foundation has convened a conversation around what does appropriate climate and health financing look like, and how do we make sure that health systems have what they need to become resilient. And then I would say another role for civil society, and something that, again, we're making progress on, but there's so far still to go. Civil society has stood side by side with WHO in calling for addressing those root causes, calling for tackling those drivers of climate change. So I think all of those areas are places where, as civil society, health professional organizations, health advocacy organizations, we can come together and actually influence what happens in those halls of power where decisions are getting made, and kind of open that door so those stories of the human face of climate change, the real implications of climate change, can be told, can be heard.
So can you just, I mean, you've mentioned it, that WHO Civil Society Working Group. Can you just give us a sense of what the discussion is, where the effort is going? Because I think a lot of people will be very interested to hear.
Yeah, the WHO Civil Society Working Group on Climate and Health was founded in 2019 at the invitation of Dr. Tedros. And I think those of us in civil society were very pleased when Dr. Tedros came in, when he identified climate change as one of his priorities right off the bat, tackling those health implications of climate change. The WHO, for years before that, had collaborated with civil society regularly, but the thing that changed with the establishment of the working group is it really formalized that collaboration and created a really, I think, a powerful platform to really go hand in hand together and reinforce one another's efforts to push this issue forward. I think some of the things that the working group has worked on, I think one of the most relevant ones to the conversation about pandemics is in 2020, as COVID was ramping up and rolling out and affecting all of us around the world, a number of high-income countries started developing economic recovery packages. And unfortunately, in many cases, those economic recovery plans were planning to invest funds in fossil fuel intensive industries. In a number of cases in the United States where I live, environmental regulations were being either rolled back or put on hold. And quite honestly, the health professionals that I work with regularly who are paying attention to climate change, but were in the emergency room or doing contact tracing or those kinds of things, they were furious. You know, they were there putting their lives at risk, working so hard to address the pandemic. And meanwhile, high-income governments were taking decisions that were going to make climate change worse, tee up further pandemics, and a host of other health issues. So the working group spearheaded a letter from the health community to the G20 finance ministers and heads of state, launched it. It had sign-on from organizations representing 40 million health professionals. WHO launched a manifesto on a healthy recovery from COVID-19 right alongside it. And this got coverage around the world and brought a lot of attention to the issue, and I think really started helping to make the case much more broadly recognized that climate change and health and pandemics are interlinked. This year, the working group has fed in on the Global Plan of Action, which is WHO's implementation plan for the WHO resolution. It's feeding into the COP29 report on climate and health that WHO is preparing. And it's also kicked off a COP task force so that civil society can be more proactive in looking further ahead at how we can bring the health evidence, bring the health stories, and bring that human face to the COP space and ensure that climate decisions are really centered on improving people's health.
I think that's good to know. So let me, before we turn to the audience for questions, and I hope you're thinking about what your questions might be, let me turn though, and it's certainly last but not least, to Ramanan. We've already had a reference to One Health and how important this is. So can you talk about what the challenges and opportunities are in this respect? If you can, I guess, think about, and it's something I think many people in this room have thought about, when we talk about integrating animal and environmental health and the relationship to pandemic preparedness, what are we going to do? How are we going to get this more front and centre? And how do you see that challenge going forward?
Great question, Jane, and great comments so far. I think we've covered a lot: civil society, equity, research, and obviously health systems. I don't know how many of you read an op-ed by Dr. Tony Fauci in the New York Times just a couple of days ago. If you hadn't read it, what he was talking about was, so here's a man who had done so much for HIV and then for COVID, and he talks about a 5-day experience with West Nile virus. And he says it completely knocked him out. He was hospitalized, he was discombobulated, he just didn't know what hit him, and he was really worried that he might not make it. Now, it's a really powerful story of what happens with something which, for someone with arguably access to the best care in the United States, right? So that's Dr. Fauci's story. But the story that I want you to point you to is the origin story of West Nile virus in the United States. West Nile virus first showed up in 2 sets of species. First, there were birds. There were crows that were falling out, literally out of the trees in New York City. And subsequently, there were various, animals in the Bronx Zoo that were infected with some kind of encephalitis. The zoo veterinarian then called CDC and said, I'm observing this, it's kind of strange. Can you tell me what this is? And the US CDC at that time said, oh, we don't really deal with animal diseases, we only deal with human diseases, and so they said we had nothing to do with this. In the meantime, there were human patients with a similar encephalitis who were being admitted to the hospital and dying of it in New York City, but no one made the connection. No one made the connection. And that was a huge lost opportunity, because if we had picked up this disease when it had entered, at the time that it was killing the crows and then the animals in the Bronx Zoo, we could have done a lot to prevent it from entering humans in New York, and subsequently now in all 50 states across the United States where the disease is spread and then, takes out Dr. Fauci, as it happens a couple of weeks ago. Now, what does that tell us? It means that in all conversations of health, we are implicitly only thinking of human health. We are not thinking of animal health, either for the reason that we care about animals or the fact that the animal health then affects us. And that's because there's now been sort of, I think, nearly a century where we feel like our health is no longer dependent on the environment. We're pretty much sort of, we're dealing with heart disease and cancers, we're dealing with things that we feel are all within our control with medical intervention. And I think COVID just snapped us out of that. It just reminded us that we still live on this planet next to a bunch of other creatures that can get the same disease and then give it to us. Take antimicrobial resistance, or just drug resistance in general. We've had probably three new fungal pathogens, unusual over the last 20 years. And we continue to wonder, where do these come from? And of course, climate is sort of an easy scapegoat. I'm not saying that climate is not important, but climate is an amplifier. Climate is not the original reason why some of these things actually happen. Aspergillus fumigatus. We spread azoles, a particular class of fungicides, which is almost exactly the same as the drug that you would take if you had a fungal pathogen. We spray it on plants, and then we wonder why the diseases that we get are resistant to this fungicide. There's no surprise there. Why does Candida auris not respond to any of the azoles? For the same set of reasons. So we've created all the conditions for things to go sideways, and then of course we blame climate. There's a reason why malaria is not in Berlin right now. I mean, certainly the vector for malaria exists across most of the world, all the way up to the Arctic Circle, right? The Anopheline mosquito exists everywhere. It doesn't exist across Europe, across the United States, Because in the US, as some of you may know, US CDC was actually set up to fight malaria, right? That's the origin, again, of US CDC. And it doesn't exist in all of these places because, to come back to Maria's point, because it's public health. And we haven't bothered to see that public health as being our first line of defense against emerging pandemics. But we also haven't bothered to see that a lot of these come with our interactions with animals, with the environment, and what we do in the environment, which comes back to affect us. Now, the thing about climate change is that, the very optimistic people say, well, the great thing is now, people can move to the temperate zones, people can move out to other places, you can live in, you might have beachfront property because of flooding. I won't say who said that, but it's someone who's running for high office in the United States right now. But what we fail to recognize is that anytime we move ourselves or our crops or our animals, we're putting them all in conjunction with a new set of pathogens that they previously never had any experience with. So this massive change doesn't just come from the heat in the places that we are. People will adapt, animals will adapt, species already moving, and they're already on the move. They've been moving already for the last 20 years. And when that move is happening, it's creating new opportunities for interaction that we have no clue about. And we're going to stumble into finding each of these one after the other, rather than getting ahead of the game and saying, what is likely to happen next? And then how can we be there to do something to prevent this? Certainly, as you started off, Jane, having sort of areas that are completely protected would be a great idea. We don't do enough of that. But beyond that, we really lack the ability of foresight to sort of see where is it that climate change is going to take us, because we're not all going to be in the same place. It's likely that agriculture will move into the temperate areas, for instance. So, and again, the last thing is to say is about, again, vector, which, to come back to this, which is, there is an expansion, but this is the confluence of our very stupid decisions today, along with climate change as the amplifier, that then create the opportunities for the pandemics. And our decisions don't sufficiently, or I should say at all, take into account the fact that when we feed antibiotics to animals, that creates drug-resistant pathogens, bacteria that come back to affect us. When we, use fungicides in particular ways, it comes back to affect us. And unless we develop a more nuanced understanding of what creates disease opportunities for us, we will always be running behind this.
Yeah, thank you. And it's interesting, isn't it? Because you look at an example such as the one with the Bronx Museum, and you see that that's a connection that's missing. But I take it from what you say that you think that we still have barriers between making those connections. What is the solution to getting rid of those barriers, do you think? To actually seeing across that animal health, human health divide, to actually properly implement a One Health approach, almost regardless of country. And the answer is, it's not that easy, Jane. But again, what would you be advocating for?
Well, take Gatinji's example. How many people here are from the animal sector?
Excellent. You are so welcome.
Yeah. But we need far more of you folks in here. We have about 6, which probably amplify that quite a bit.
And who's here from the environmental sector?
Even worse.
We've got 4, actually.
At least there's some. And that was 2 hands. I saw that. That's cheating.
No, but even so, I think some of it is cultural. I think there's a sense of folks working in human health, and all present company obviously included, that we think that we have it all sorted out just within this one sector, and we don't need to really talk across. That has changed in some areas. I would say that in the case of antimicrobial resistance, in some countries, is much better One Health coordination than there ever was before, sharing of information and data and so forth. But that cultural connect is the first thing, which is to not see someone as the other, but see them as an essential part of what it takes to protect human health itself. The second is investing in things like surveillance systems in a One Health kind of a way. We're already moving in that direction with things like wastewater surveillance, because wastewater, in effect, unless you're looking just at healthcare facilities, picks up a lot of pathogens, whether they've come from humans or from animals. So I think as we develop more of this kind of surveillance capacity, we'll be able to connect the dots a lot better. The third, I think, is to actively engage in things like animal health in ways that are mindful of human health. So to give you an example, if you look at vaccine coverage with the most common vaccines that animals need in the high income versus the low and middle income countries, the gap is something like 99% in a country like Germany and 2% in a country like Kenya.
Yeah.
Right? This is a bigger gap than we even saw with childhood vaccines prior to Gavi coming in, or our emphasis on childhood vaccination. How can we prevent animals from animals from the zoonotic pathogens from spilling over into domestic animals if we haven't vaccinated them yet? They're not different from us at all. And so unless we take this on as a challenge and say we need to focus on animal vaccines, focus on animal health as a primary way, as a first stop of preventing diseases from getting to us, and recognizing that domestic animals are usually the way in which diseases do get to us, we're fighting the last battle and not the next one.
I'm looking forward to one of you telling the anti-vaxxers across the street on the way out that we're moving on to animals next.
We're very little hesitancy on their part.
That's true. That's true. Now, we're going to move to some questions, and I'm going to ask Eloise Todd from PAN to get you started. We'll find the microphone. But while the microphone's coming over,
may I say something?
You may.
I'm just listening to all my colleagues, and all these are so compelling. But when you think about this, it's really, as I think Maria's leaning over, it's really the totality of our environment that really what we're talking about. One health is one aspect of it, but not all. If you think about the need to look at all sectors,
Totally right.
right? So people talk about net zero, but never talk about well-being and net zero. The whole idea is that, well, if you look at construction, urbanization, if you look at transportation, you look at energy, agriculture, cattle, every one of them are contributing to climate change, right? Health sector, actually, as I said, 5%, but the others are 95%. So I think it takes everything, not just one or two sectors. And the focus on these sectors look at, okay, you are doing all these mitigation efforts. What's it doing to human health? That's never been studied. So you think, oh, it makes sense to trap this thing here, trap carbon there, or change the agricultural things. And all this thing had to be really looked at with a human health lens in mind. And when you look at human health, as been said by Jeannie and others, and you measure, what about productivity? What about illnesses? What about time lost? What about hospitalization and the whole bit, and savings? It could be a huge economic impact that nobody's ever thought of. So my pitch will be, let's bring all these pieces together and look at human health as the focus, but it's all the sectors, in addition to One Health, animal sector, and all the other sectors as well.
Let's compete with next door and thank the speakers. I like your competitive spirit, but when we get to the end, I want better. Okay? Now, we have time for questions, as I promised. Can I ask you to do two things? Firstly, have your pithy question ready to go. And secondly, tell us who you are. Eloise.
Hi there, I'm Eloise Todd from Pandemic Action Network. That was Eloise Todd from Pandemic Action Network. Thank you so much for your brilliant comments and commitment to these causes. We call the pandemics and climate change twin threats. And we believe that in order to tackle them, we absolutely need to invest in systems, but we need to do it with a sort of more urgent trajectory in mind, thinking about what will the needs be of people living in the tropics and living in coastal areas and the most vulnerable populations everywhere, which will need absolutely huge investment, which means that we need to be in the finance conversations too. So my question to you is, if you could have your dream scenario of breaking down a silo, whether it's briefing world leaders at the UN Security Council, whether it's engaging with finance ministers, what would your dream silo breaking moment be, and how can we work together to make it happen? Thank you.
Awesome. Okay, I'm going to ask for a quick response from our panel members, because we could talk about that one for hours. Who would like to? Jenny.
Pithy response. First, I want Victor to make sure we have the research that shows the cost of inaction, and then I want to brief all the finance ministers of the world.
Awesome. Gitinji?
I would go back to research and define the costs of the foregone GDP for each country from non-response to climate change, foregone GDP.
Victor?
Jenny just threw me a nice softball. I think absolutely you have to link them together and look at what's the cost of human lives and also the economic impact as well.
Maria?
I think this is a very good opportunity to talk to them. Few messages. One, close the tap. Don't forget that we need to tackle the causes of climate change. So stop the dependence on the combustion of fossil fuels. Don't forget that. We are talking about adaptation all the time, but one of the best vaccines will be closing the F tap. The F being... Yeah. You wanted a headline. Here you are. Close the tap, accelerate this transition.
Great headline. Love it.
Well,
I think we're all set.
and of course, I will go again for if you don't pay for what you are destroying with this flooding, and you still don't use the health argument as the unique one to accelerate action on climate change.
Yeah.
Can't top those great suggestions. We'll go with that.
Okay, awesome. I've got one here. I've got, oh my goodness. Okay, Pithy.
Hello, my name is Rahaf. I'm from Syria and I'm a pharmacist in Portugal. I just would like to add and highlight the role of conflicts and wars also in the emergence of climate change and the pandemics. Being from Syria, I would like to give an example from my region. For example, the war in Syria that started in 2011 have generated many infectious diseases that were not existing before the war. And I would give the example of cholera that generated many deaths, especially in refugee camps due to the lack of drinkable water. I would also like to give an example from my region, the war currently in Gaza in the Middle East we have detected actually the polio virus after the endless efforts of the WHO to eradicate the virus wild war. So my question is, facing and in the light of all of these wars, all of these conflicts, how feasible is it to achieve the One Health and to achieve solve the climate change crisis?
Thank you.
Thank
so
you.
what I'm going to do is I'm going to give the question just to a couple of our panellists, because we have so many questions popping up. So Ramanan, you're the obvious place to start.
I'm glad this point came up. The levels of drug resistance that you see coming out of Gaza are extremely high. We had Hanan Balki in New York just a couple of weeks ago talking about that, and similarly in Ukraine as well. It is going to be very difficult. That's really the thing. And climate change is going to amplify what's happening in the conflict zones, but the conflicts are really generating a huge public health problem of their own, no question.
Thank you. And Gitinji.
I think I'll go with his answer, because this is a very complex issue, because of course we see for every single health system issue, fragility is related to peace. Peace and health are one. So I think that we have no way out. We have to make the world a peaceful place. I think we must focus on peace as a way of human prosperity. And I think band-aids of doing this and that, and I know, zero-dose children are in fragile conflict states. AMR is rising. So I think the ultimate solution is for the world to be a peaceful place.
Thank you. Down the front.
Okay. Good afternoon. My name is Tuntea. I'm a clinician from Ghana. My question is that, okay, so when we talk about climate change, everyone is talking about climate change and what we can do. But first things first, everyone is talking about investments, but what are the things that are causing the climate change? And what are you putting in place, or what should you put in place, what measures should you put in place to stop these pollutions from happening, which cause the climate change, instead of just talking about climate change and what you're going to do right now, and not talking about what causes the climate change? Thank you.
I think it's a very challenging question, but let me tell you something. Here we are talking about pandemic threats and how to be better prepared for responding to a pandemic. But at the same time, while the world is trying to reach an agreement on pandemic preparedness, the same world is contributing to a pandemic, because everything we are doing, don't forget that it's human. I mean, we, the humans, are contributing to the pollution. So we are the ones that we need to solve it. We are destroying biodiversity. We are polluting everything we touch. The ocean with millions of tons of plastic, the land with all the chemicals and the fertilizers and the pesticides. So unless we stop with this kind of suicidal approach that we are having at the moment regarding the ecosystems, we will not be able to solve anything. 3 transitions we need to do very quickly, and hopefully Africa and all of those that you were calling in before, the passion from that continent has to come on the transition to clean sources of energy. Don't be as stupid as others we did already. Be the clean one. Transition to clean sources of energy. You can solarize the entire Africa with this. Second, transition to sustainable food systems. And third, the transition of an urban, healthy environment in our cities. If we are able to lead in the name of health these 3 transitions, I think that will be the best we can do to humanity at the moment.
I think that's...
I could make a very quick intervention as well to add to that, that actually part of the problem is market systems. And we have to address market systems. And market systems respond to incentives or disincentives. We have to tax carbon. That's the bottom line. You pollute, you pay. Carbon taxes must come on the table for climate discussions. I think on the conflict, there's one more thing I would like to add about community knowledge. That in the meantime, as we make the world a peaceful place, communities must be relied upon. This whole thing about resilience is about community level, and the communities know, even when there is a war, when there is they know what to do to protect themselves as well, but we don't pay attention to community knowledge because we think the only knowledge we pay attention to is one that's published. But how do we get community science in the middle when communities are in movement and that kind of thing? But ultimately, people must pay for what they are emitting so that we make the world a safer place.
Victor, then Jenny.
So making governments pay. But if you think at the end of the day, as you said, it's really about economy and market, right? Why do these industries are so successful? So I think you're going to have to think about the industry, not just the government itself, right? Fossil fuel, you just talked about this. Many other industries are really so, but we're so dependent on these industries as a means not only of our lifestyle, but also our economy, right? So I think this is a very complex issue that has to be dealt with.
And Jenny, last word.
Very briefly, just the one thing I'll add into the mix. It's not only that we're not taxing carbon, we are actually currently subsidizing the use of fossil fuels. I believe the direct subsidies are over $1 trillion a year. And the indirect subsidy, all of the impacts from those fossil fuels then fall on the health systems and communities and so forth. And so those indirect subsidies, like what we have to pay to make up for those impacts, is another more or less $6 trillion. So we're actually paying the fossil fuel industry right now to do what it does. Yeah.
Yeah.
And why? Why?
Why?
How long do we have, Victor?
Okay.
That's where civil society needs to get active.
Yeah, that is so totally true. Okay, I've got one here, then I've got a gentleman behind, and then I'm going to find someone at the back of the room. Yeah, so whomever the gentleman's arm that is up at the moment, you're next, sir. Please.
Thank you. I'm Tanushree Jain, serving as the chairperson of public health at the International Pharmaceutical Students Federation, abbreviated as IPSF. So my question to our esteemed panel is, how we as a youth organization, and not just us, there are so many young people present here, how can we mobilize resources toward, and capacity building towards awareness about One Health, and also what can we do better to encourage meaningful youth engagement from various stakeholders in the CCH space? Thank you.
Okay. Okay, I have a volunteer on the end. Ramanand. Plenty. I think they all want to answer that question.
No, it's great to see all the the young folks here and engaging in this conversation. I think the way in which you're organized itself could be in a much more of a One Health fashion, right? So we're very siloed in the ways in which we're thinking about things. We think of our responsibilities as just, say, pharmacy for humans, but how much are you really looking, at what drugs are being given in other sectors? Because it's not like drugs go to only one place. Antibiotics get sprayed on fruit trees as well while being given to people. So I think bringing that into how you're organized and then bring your attention to the issue in that way could be quite different from the way we've done it in the past.
Anyone else? Kitinji? And then Jenny.
Yeah, I think that we need to pay a lot of attention to national advocacy and the value of national advocacy in changing national policies. And I think youth groups and other civil society must not forget that actually nationally is where it all works. And pushing parliament, for example, working with parliamentary unions in country to change policies and also to finance those involvement activity, domestic resources as powerful as international resources in driving national policies. So I would say let's focus on national and then drive the national movement to regional and global movements.
I'll just add one comment. I have seen the power of the youth voice and youth advocacy, and in a very kind of personal way, youth advocates can get meetings with delegates and decision makers that some of us have trouble getting. So don't be afraid to go and knock on a door and ask for a meeting, because you may be much more likely to be let in than some of the rest of us. So deeply believe in the power of youth advocates.
And Victor?
Well, youth engagement research is really important. There's lots of people doing photo voice, citizen scientists, really collect the information, because we said, while we're passionate about what we think the right thing to do is, frankly, we have so little information about what the right thing to do is. So youth can be mobilized, being a major, source. We actually, in our collaborative, we use high school students and others in community to really look at what we call photo voice, right? Collect the information. I think that's going to be very powerful. Once you have that data that you put together, that's really powerful in terms of stories and driving changes.
Yeah, and let me add one. I'm breaking the rule of the moderator here. Oops. You have to understand what is the policy framework in your country. Jenny's raised the point about where there are fossil fuel subsidies. You need to know where they are, because if you go to lawmakers and say, there's a problem with fossil fuel subsidies, they often won't even know where they are. You have to tell them what it is that needs to change. And if you think about it, one of the things we know, for example, about the adoption of solar panels is there is a hump to get over before they generate their own momentum in terms of the cost return, et cetera, Sometimes government actually has to swap its subsidy from fossil fuels into those new industries for adoption. And once it moves, then you're going to have sustainability. But we could talk about this. Now, I have two more people to ask questions. I've got the gentleman who's got the microphone, and I'm hoping the gentleman with the wrist that I saw up the back has got one, and we'll see how we go. We have to finish on time. Please.
Kamaran from Kurdistan region of Iraq. I'm clinician and member of Kurdistan Health Summit. Actually, my comment is an overview. Since the last 20 years, we are talking about the climate change and the approach and the strategies that have been worked until today. It's thankful, but we see we are going to the worst. So can we just think in another way that is there any defect in the strategy and the approach towards the solution of the crisis in climate change? For example, I have seen a movie in 1970. They are talking about the climate change. And today we are talking about climate change. So maybe if we change the strategy, instead of coming from top down, because our challenge is with the decision makers, what we clinicians know scientifically, we have to translate it simply to them so that they become convinced. So instead of that, coming from top down, let's come from down up like youths. So when the community, instead of group of health professionals talking, all the community press on the decision makers, then involuntary and automatically they have to decide for the future. So we have to change the strategy, I think, because we are getting worse. Maybe next year it will be worse, which I don't hope. Thank you.
Thank you. All right. Yes.
Yeah.
Maria.
Before thanks for the question. And before somebody was asking as well, what will be your dream moment, what you will say? My dream moment will be just at the opening of the COP29 or COP30 or COP40, because we are moving into COP40, 50 and others, having 5 minutes with the negotiators alone, close door and say, guys, you think you are negotiating emissions? You are wrong. You are negotiating with my health, with the health of everybody here around. You might decide, with your decisions here, you might decide how many cases of lung cancer we are going to have, chronic obstructive pulmonary diseases, brain disturbances and everything. Now go and negotiate. And I will see how comfortable it will be. But you're right. But you are absolutely right. We cannot put all our hope and all the decisions in the hands of the high-level people. The real change will come from us, individuals, whether we take a bicycle instead of a big car, whether we glamorize the fact that we are not consuming the way we were doing before. Margaret Thatcher says 40 years ago, if you are 30 years old and you find yourself on a bus instead of having a big car, you are a loser. These things are changing, thanks God. And now you are a loser if you are driving a huge car in a small city. Well, not yet. But this might change. Now you are a winner if you are on a bicycle or you are, contributing to recycling, many things that we can do at our level, and this is where the real change will come from.
I'm going to take one more comment in this so I can get my gentleman with the wrist in.
I was going to say that, this is a slightly pessimistic view, but the opportunity for mitigation, for doing something about climate, in many ways we've lost that. I know it's a terrible thing to say. There are still opportunities ahead. But the last, 50 years when we could have done something, we've lost that opportunity to a large extent, which means that now the challenge is both in pushing for change, but also that we're going to be hit with a flood of health events that we're just not prepared for. And I think that flood of health events will do two things. One, it will overwhelm us unless we get better prepared. But that flood itself will convince the policymakers to do the right thing, because they will do the right thing after they've exhausted all the alternatives.
Yeah. And can I make another suggestion to everyone in this room? Do what you can. I live completely off-grid in Australia. I'm not connected to the electricity grid. To be fair, we have a lot of sun. The question at the back. Thank you, sir.
Yeah, hello. Yeah, so I'm Emmanuel Omovie. I'm Nigerian, and I work in business development for medical technology. So my question is from Gitangi's comment on the Global South's markets and incentives. So it is fact that the Global South accounts for the least carbon emissions. However, I think we would agree that, I would say that it's not necessarily, it's circumstantial, not necessarily because we have more appetite towards climate change or climate resilience. So, for example, infrastructure, we don't have as much infrastructure as like the West, for example. But that is changing, where technology is increasing, infrastructure is increasing. So, but you find that, like in Nigeria, for example, where the train network is very underdeveloped, you would see a train railway constructed and a locomotive diesel train that was probably used in China or somewhere in the US in the 80s is what is being commissioned in 2024. So, yeah, that's the fact.
So, sir, the question, because otherwise you're going to get no answer.
Okay, yeah, so it means that we are catching up with the West in terms of carbon emission, right? So what can intergovernmental organizations do to incentivize governments from the global south or hold them accountable, you know, to ensure that as investment is increasing, that investment is towards climate resilient infrastructure?
Gitinji?
Okay, so let me comment on that first and say that you are right, that actually part of the reason why there is such low carbon emissions is because of inactive economies, literally. It's like the economies are so low, the fiscal space is low, the GDP per country is low, everything is low, and therefore there is not much activity, and therefore there is low carbon emissions. So you can say there is a pro and con for that, and the pro is that here we can start to work on Africa developing a different path to its development, and that has already started. But let's remember that, and maybe this back to the question that were there earlier, that actually it is more profitable to pollute than not pollute. This is the problem we are having. We must realize that profit is at the center of pollution. I've actually worked with an organization that, very high level, a global organization that had the intention to put out that they're actually reducing their emissions. But when it came to touching on the nerve of changing their packaging, for example, and their sources of raw materials, that meant that they would affect the margin they're making from each product. It would then snowball to their profit reduction. It would then reduce their stock exchange price on the stock exchange, and the whole advisory group was dissolved because you should not touch the profit. So the issue is that we must realize that profit at the center, and profit is where we need to hit this whole pollution issue. And that's why I keep saying, you pollute so that you make more profit. That profit must pay a tax so that you can then support the just transition and also support the reduction of vulnerability risk. I think that's really what I would like to say.
And that is a good point to finish. So, Ramanan Laxmanarayan, Jenny Miller, Gitanji Gate, Victor Zhao, and Maria Nera, can I ask you to take the roof off and beat them next door? Thank you for coming. We so appreciate your attention. And to the young people in the room, there is still hope. Thank you so much.